You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. I'm super excited about this week's episode. Ivan, please go ahead and get us started.
Hi, I'm Ivan Zach, and I'm happy to reintroduce you to a friend and a colleague, Dr. Jennifer Ogeer. She was here before, and her episode ranked as a top 3 most listened episodes on Veterinary Innovation Podcast. Just to remind you guys about the biography, so Jennifer is the Vice President of Medical Affairs at Antech Diagnostics. She's the Chair of the Board of Directors with Veterinarians Without Borders, Vice Chair and the Treasurer of the Board of Directors of OVC Pet Trust, Vice Chair of the Board Directors of the DVM Coalition, previously Medical Affairs Marketing Manager at IDEX, University Professor of Emergency Medicine and Critical Care in Saskatchewan and Texas, DVM, Residence and Masters in Critical Care Medicine, and Exec MBA and Masters in Organizational Behavior and Leadership from University of Guelph. Whew.
You okay over there?
I was worried I'm not going to read it all at once. I think I managed that. And she was previously our guest in February of 2020, where she discussed the artificial intelligence in diagnostics. Jennifer, welcome back, and thank you for joining us again.
1 year later.
Yeah, thank you, Ivan, and thank you, Shawn. It's a pleasure to be here. And thank you for the honor of noting that the artificial intelligence topic was one that was well listened to. I'm just really pleased to hear that it is something that in veterinary medicine, I think it's changing the way we're going to practice as veterinarians. And there's definitely more AI machine learning tools to come down the road. So great acknowledgement and promotion of that.
Jen, 1 year. My, how things have changed. What have you been up to since we last spoke?
Wonderful. Well, I've been busy. I think we all have been busy, but we've learned to live in an environment that is definitely a new normal for us. I think we've adjusted to a remote existence. We have learned to develop relationships in virtual environments, but I think we continue to stay, as much as we can connected to each other, to the work that we do. We continue to build on our passion and purpose. And I think for me, it's always been about contributing to this idea of One Health in various avenues and various ways I can contribute, whether it's through my personal or my professional or my volunteer activities. And so I'm really excited today that we get to talk about One Health and the advances that are happening and the diagnostic applications that we can bring to veterinary medicine.
So, for those that are not familiar with One Health concept, what it is about, and how we can learn more about it.
So really One Health, I think, is this really critical global imperative, right? That it seeks to help us better understand what are those natural linkages between human and animal, and I'll also include wildlife health. And it's that connection, that interconnectedness with the environment. And so really it underscores the absolute necessity of bringing all of these elements together. If you think about sort of the definition, the CDC, so the Center for Disease Control, they talk about One Health as the collaborative effort of multiple disciplines working together, whether that's locally, nationally, or globally, so we can actually achieve optimal health. And so this interdisciplinary collaborative approach is one that I think takes teamwork. It takes all of us who has an interest in human and animal health as well as the environment. And as we sort of work together in these communities as specialists in various areas, I think we're having a much bigger impact on identifying the problems, but also solving what are these major health issues. And the pandemic certainly has highlighted that as an issue that has brought us together from a human, animal health, and an environmental perspective.
So with that, of course, first thing comes to mind on the current situation with COVID. So what are those highlights where the veterinary medicine could collaborate with the human medicine, and what are those approaches of One Health that could contribute to the solution of the current situation?
Yeah, it's a good question, Ivan. As veterinarians, I think we've always been at the forefront of thinking about zoonosis and infectious diseases. When you think about the father of the CDC, see James Steele and other veterinary innovators in that area, like Calvin Schwab, the pandemic really has been a wake up call about infectious diseases and the major threat it has provided for us to be able to work together, like I said, in this sort of collaborative way so we could combat what are these challenges we face and try to be successful. And I think for us as veterinarians working with government, with public health officials, with social scientists. So much of what we're doing involves behavior changes, as well as working with medical professionals and scientists, right, to be able to sort of do what's best for the general public, as well as our veterinary patients. And I think for One Health to really be successful for us as veterinarians, we have to think about it as what can we do for early detection and early response? And early detection really translates for me to something like what is rapid and accurate diagnostic testing methodologies that allow us to really either identify the presence or absence of these pathogens, these infectious agents, so we can actually have this early response and appropriate treatment. So veterinarians know diagnostics are critical to One Health. And I think one of the things we've been doing at Antech is we've been continually trying to innovate in ways that use data, science, and technology so veterinarians can meet this One Health challenge. And, we talked previously about artificial intelligence and renal tech. And I think part of our commitment as veterinarians to One Health and the One Health initiatives are these innovative veterinary diagnostic tests and that focus on it where we can bring accurate, reliable testing that give veterinarians confidence in the results that they're reporting, but in the work that we can do to also support public health and the information that we gather about these emergent diseases like COVID-19.
So, what was there? Is there some sort of a contribution that that veterinary medicine is doing directly towards the COVID-19, or any sort of development in the in the animal health models, whether it's modeling pandemic or the vaccine response, or is there any work done in that direction?
Yeah, so we've been doing a number of different things in terms of veterinary diagnostic testing. I would say, in a broader base to really think about the One Health initiative. So we're exploring ways, for example, to improve antimicrobial resistance. So we know that what has been described as this perfect storm is this idea of that bacteria are going to develop resistance genes at a rate faster than which we can discover, develop, or even approve new antibacterial drugs or antibiotics. And with the ability to sort of not do that in a way that we can combat the rate at which resistance is happening, we're actually having a perfect storm creating. So this idea of antimicrobial stewardship has come up, and it really is sort of what are we doing as veterinarians to really preserve the effectiveness and the availability of the current antibiotics we have through sort of things like responsible decision making, what is good sort of conscientious oversight of the use, how are we safeguarding animal, public, and environmental health? Because we know a large amount of the antibiotics are used in animals may potentially even come through the food chain to people. So, faster detection of these bacterial infections, for example, and maybe identification of the resistance mechanisms through molecular diagnostics really helps us facilitate antimicrobial stewardship. And one of the things we have done at Antech is we've launched a test called First Tract. And this is a test that sort of really helps us figure out whether there's bacteria present in a urine sample in approximately 5 hours. And with being able to use a patented technology, it's a light scattering technology to see whether bacteria is growing at a rapid rate in the sample, we're able to tell a veterinarian whether or not it's appropriate or not to use antibiotics in that patient. And I think being able to have that information, we're actually helping to support that guidance around judicious use of antibiotics and really supporting that One Health initiative. When you talk about the pandemic, I think one of the big concerns was the risk of SARS coronavirus 2 infection from people who were confirmed or suspected to have COVID-19 to their pets. And what we were able to do is we developed a surveillance program, and now we have a commercial test for SARS coronavirus 2 in animals that allow us to now understand the dynamics of virus transmission, because there's still a lot that we're learning and we don't know. But what I think is important about that is critical data we can now share with government officials, public health officials, and even animal health agencies. And so these sort of what I call real world, real time data examples really allow us to better communicate in a really calm, fact based way. And so the recommendations when we make to pet owners about your pet is at minimal risk of developing, SARS coronavirus 2, there is, in support of the CDC, the AVMA, and the OIE guidelines, there's no need for widespread testing. All of that leads, I think, ultimately to, pet owner confidence in what we're saying to them. We're able to update information and better understand exposure. But I think we also are able to minimize panic and anxiety. And I think, using a very deliberate, fact based approach to how we communicate this awareness of One Health will really sort of help us in understanding this pandemic and maybe even future pandemics. And I think pet owners really play a critical role in this as One Health ideal, right? We give veterinarians this real time, tangible data, and then they're able to then educate and communicate these One Health concepts to pet owners. And they respond by taking their pets to veterinarians in a way that is responsible, but without acting sort of out of a place of fear or anxiety and concern.
That makes sense. And the a lot of listeners probably, a lot of stuff was coming out through the media about the, COVID and everything else. But one of the rumors that was circulating, whether dogs or pets, so cats, could be a transmitter and a vector for the transmission between humans. So is that something that could be sort of proven not to be a concern through the testing, or any work done in that direction?
Yeah, so I think there's a big multi-center collaborative study happening. It's actually happening with Dr. Scott Weiss and Dr. Beansley and some other centers at the University of Guelph. And they're really looking at the seroprevalence of this disease, particularly in companion animals and in cats, because we know cats do have the ACE2 receptor, which makes them a bit more susceptible, similar to the human host. And I think as we start to learn more from these studies, we'll have a better understanding of not just what is the risk, but what is the dynamics of the virus transmission going from humans to animals. And based on all the data we have so far from the CDC and the USDA and even the Public Health Agency of Canada, we know that widespread testing is not recommended for pets. It's still recommended that, again, like I said, very social behaviors are in place. We wear masks, we do social distancing, practicing good hand hygiene and sanitation. If you have a pet in your household, keeping your pet indoors if you are known to have COVID-19. All of those are things that are all behavioral modification techniques that honestly the science and the technology is there, but we're asking people to do things with their pets that is a different way of how they interact with their pet, but it's a responsible way for us to ensure that, again, we're decreasing the risk of transmission.
Interesting.
I find this fascinating. And, one of the things that comes to mind is, if I'm a veterinarian in practice, how do I learn more about this? And what is Antech doing to kind of give the veterinarians exposure to these One Health principles and all of the work that you're doing around it?
So we have a number of initiatives around One Health, which I've just described a few of those examples. And we provide education. So we certainly provide webinars. We have information on our website. We work within our broader framework of the Mars Pet Care and the Mars Veterinary Hospitals to disseminate that information. But I think it's also working with public health officials and working with infectious disease specialists in this area to allow this idea of collaborative efforts around the information sharing we have, whether it's, something around SARS coronavirus 2, even something like ringworm. We recently last year launched a FAST panel, which is a molecular diagnostic DNA-based test, which has so far been the most comprehensive test to identify ringworm in dogs, cats, horses, even rabbits and pocket pets. And I think most people notice ringworm is something that is highly infectious. It can go from animals to people. And as we develop these tests and we educate veterinarians and we share this information through infectious disease specialists and broader networks of communications, things like the Global Health Network and other One Health initiatives, we're able to inform veterinarians about what is early detection, rapid, accurate testing, and of course, rapid response. Because if we're able to, with a molecular test, identify a pet has ringworm, then we're better able to treat them sooner. We're better able to isolate them. And like with any infectious disease, decrease the risk of transmission to other pets or even to humans. And I think all of these have impacts in various ways. If you think about large housing situations like shelters, I used to be the chair of the board of directors of a humane society. And I remember we had a ringworm outbreak that made us shut the shelter down for 3 months. And that was devastating to try to place these animals. Subsequently, the high costs with isolation and care and trying to find alternative housing solutions for these animals. It's quite a challenging situation when you're dealing with infectious diseases in these sort of densely housed situations like that. So all of those are, I think, important areas of concern and important areas that we've been working hard to communicate across communities, the veterinary community, but also to share with public health officials and the public. There is another area I think we all think about as veterinarians, and it's this idea of parasitism, right? We've been sort of learning that through vet school. And I think as people, we think about the public being concerned about could they get something from their dog's feces, for example, or in cats. We always think about conditions like toxoplasmosis, particularly for pregnant women. And so now we know through diagnostic and molecular testing, there are certain assemblages in diseases like giardiasis that can go from humans to animals that are specifically zoonotic, meaning they can transmit from animals to humans. But there are certain assemblages that are not zoonotic. So through using, again, DNA-based testing, we're able to identify what could be at risk or not at risk for a person. And if you have an assemblage identified that's potentially at risk for a human in that household and they're a senior person or an immunocompromised person, again, there is an opportunity there for the veterinarian to educate that pet owner and that household about the need for testing for something like Giardia, which can cause significant gastrointestinal disease.
Jennifer, the one thing that you mentioned about antimicrobial resistance, I think it's a very hot topic in different food safety and other circles. You mentioned about the test that determines in 5 hours the presence of bacteria. Is that specific to the bacteria and the direction of antimicrobial choice, or is it just determining the presence or absence of the bacterial infection?
First track really allows us within 5 hours. So it really is a very rapid growth of the bacteria of the urine using this unique, light scattering technology to tell us whether the bacteria is present or not. It doesn't actually tell us what's the species of bacteria or what antibiotic it will be sensitive to. We still have to use traditional methods to do that, but it is a culture that's happening at a very rapid speed. And I think with knowing whether there's bacteria or not in a urine sample, that then helps a veterinarian to decide whether or not antibiotics are appropriate to use or not in that patient. They still have to wait for the results of the antibiotic antibiotic sensitivity testing to do that. But I think what it's doing is it's limiting unnecessary or inappropriate use of antibiotics. And if you look at some of the data from the CDC, about 40% of antibiotics that we use currently are actually unnecessarily or
Wow.
inappropriately prescribed. And when you look at even the veterinary studies that are out there, there are very similar numbers cited. And these are patients that don't have evidence of infection. And so what we're seeing is that by the use of these antibiotics, which actually, as a critical is what I will say, my research focused on the use of antibiotics in critically ill patients. And that actually is the biggest selection pressure for driving antimicrobial resistance, inappropriate or not using the antibiotics at the right dose or for long enough. And what we see sometimes in livestock is they use antibiotics as growth promoters at a
Mm,
subtherapeutic level. That's also promoting antimicrobial resistance. So there's a lot of what we can do with technologies like First Track that gives us a urine culture quickly, so with very sensitive and specific results, so we can make those decisions as veterinarians that's going to be responsible. It's going to be in support of One Health. It's going to support this idea of antimicrobial stewardship. And I think as veterinarians, we are leading the chain of command with that, particularly because we know most of the antibiotics are being used in animals. We have an opportunity to be a leader in this area.
absolutely. And now with the whole history of the last year and the pandemic, it kind of feels like, I went through vet school a long time ago, we shall just say. And then at that time we were talking about antimicrobial resistance and all the, the rules around it and the risks. But we're still like, if 40% of the cases are receiving antibiotics and they were unnecessary, we're still not paying enough attention. And it's, I just remember this one speech that Bill Gates had about the whole pandemic. Everybody probably seen it, when the COVID erupted. And then this speech that he was talking about how the humanity is not ready for another pandemic. And it sure happened. It just feels like this is another thing that will happen. And we're not doing enough in this direction. And we will face this another disaster. So hopefully not, but it's just one of those things that people are like, oh, it's like global warming or, another thing to talk about, but not really be proactive. I did not realize how much time we spend already. It's always such a pleasure talking to you, Jennifer, that we just run through our time limit. So we'll have to cap with a couple questions that we usually ask. One of them is, do you have anything that recently inspired you, whether it's a TED Talk, a book, or interesting article that you could recommend to the listeners?
I think we were all inspired by Poet Laureate Amanda Gorman at the inauguration speech. I have to say, of all the things I've heard in a very long time, that really moved me in a way that I felt was politically, emotionally, and societally really impactful. And she said something that has stuck with me, right? She said, there is always light if only we are brave enough to see it, and if we are only brave enough to be it. And I think as veterinarians, we can be brave enough to be the pioneers, because we have been in this One Health initiative and really sort of bring success to this idea of human, animal, and environmental health working together to really build a community where at the end of the day, we're giving pet owners what they need, the best pet care. We're supporting it with advanced diagnostics, but we're also enhancing and extending pets' lives. And in turn, we're benefiting human lives. And that really should be the ultimate goal of why we're here.
That's amazing. Yeah, it's so good to hear you speak again. It's such a pleasure to kind of get a chance to kind of ask you questions and see the lovely work that you guys are doing. And so the last question is somebody else in the space, another innovator that you think we should have on the show.
So, another innovator I would recommend who has inspired me, he's been the founder of Veterinarians Without Borders for Canada, Dr. David Waltner Taves. He is a veterinary epidemiologist, he's a poet. vet. He's a writer. He has written books like Food, Sex, and Salmonella. He recently wrote a book that I think you will find really incredible. It was on pandemics, deadly diseases from the bubonic plague to coronavirus. And he's just this incredible storyteller as well as a veterinarian. And he has inspired me. His work around animal and human health and really about eco health and ecosystem health has been incredible. So I would encourage you to think about having David on the show.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.